I'm Dr. Rachel Rubin, urologist and sexual medicine specialist in the Washington, D.C. area. I got a yeast infection with vaginal estrogen. What do I do? Well, it's a really good question, and this can happen sometimes. Don't panic. So why is this happening? Well, the vagina wants to be an acidic environment. We want it to be a pH of about 4.5. But what happens in perimenopause and menopause is you lose the acidity, so there's not as much acid around, and so the bad bacteria can start to grow. This can lead to things like bacterial vaginosis, pain with sex, urinary tract infections. Well, what happens when you use vaginal estrogen is the body starts to acidify again. And as it becomes more and more acidic, yeast, which wants to grow in yeast, starts to pop up. So occasionally you start vaginal estrogen or DHEA and you could get a yeast infection. Now here's what's important. Treat the yeast infection either with a diflucan or another type of yeast infection, but don't stop the vaginal hormones. When the microbiome finally fixes itself, and it takes about 2 to 3 months to do that, then we really don't see chronic yeast infections happening. The other thing is it might not be a yeast infection. We find that when you use vaginal hormones, the body is starting to heal. So if you ever gotten a sunburn and you have the pain phase, but then the itchy phase happens, so sometimes as the tissue is healing, it can cause a little bit of itching. So not everything that itches is actually a yeast infection, which is why you want to see a specialist who can actually do a good exam, get a swab, and really understand what they are treating. It also turns out that the problems that happen in perimenopause and menopause, the dryness, the irritation, when you put something inside your body or you put a cream in and you rub the cream around, it can hurt, just like if you put aloe on a sunburn. So if something itches or you have discharge, it's not always yeast, and you do want to make sure that you get the diagnosis right. But if you do get a yeast infection, don't stop your vaginal hormones. Keep going, and I promise in 2 to 3 months it should take care of itself and you shouldn't get chronic yeast infections. Please subscribe to our YouTube channel and follow along for more advice.